Hello and welcome to the Oakland County Megacast. I'm Tyler Kieft in the studios of 89.3 Lakes FM and Civic Center TV alongside Ronnie Dahl, as we are each and every day from 10 a.m. to 12 noon live and throughout the afternoon and evening and the next morning over for replays on our family of TV and radio stations live today, as we always are, on Birmingham Area Municipal Access and Civic Center TV on Comcast Channel 15 and AT&T Channel 99. In addition, we're online in high definition on civiccentertv.com/watch-live. And you can also just go to our website, civiccentertv.com. Right on our homepage, we have a link that says Watch Live. You can watch us live during the show or during our other programming all throughout the day, 24 hours a day, 7 days a week. In addition, we're on a couple of great community radio stations. Of course, our flagship station, 89.3 Lakes FM, and on 88.1 WBFH, The Biff out of Bloomfield Hills. Today, also, we are on the Facebook page of West Bloomfield Parks. West Bloomfield Parks, our Facebook partner for the day. And so for you tuning in over the West Bloomfield Parks Facebook page, we thank you for joining us today. As we continue to celebrate the month of July, which is Parks and Recreation Month. So if you have a chance to get out to all your local parks and enjoy some of the beautiful landscapes we have in the Oakland County area, some great recreation, some safe recreation. We have plenty of great local parks, not only in West Bloomfield, but all throughout the local area as well. We also have some great news reporting going on right here on the Oakland County Megacast and on our website at civiccentertv.com/coronavirus, where you can find all the latest information about the COVID-19 pandemic and other big news stories around the local area, as well as reputable resources to, for example, national resources such as the Centers for Disease Control and Prevention's COVID-19 information, the State of Michigan's COVID-19 page, and Oakland County's COVID-19 information, which includes access to finding appointments and scheduling appointments for COVID-19 testing, as well as other resources for businesses and residents alike as well. Plus, information from all of the local municipalities that we cover here in Oakland County on our show each and every day. And, of course, our top headlines. Today, our top headline, Governor Whitmer has extended the state of emergency through August 11th. The state of emergency does not place any restrictions on Michigan residents like the stay-at-home order previously did, but it allows Governor Whitmer to issue executive orders that place such restrictions, such as current orders against gyms and theaters being open in South and Central Michigan, restricting occupancy at dine-in restaurants, and requiring face masks in indoor public places and crowded outdoor spaces. The state of emergency had previously been scheduled to expire this week on Thursday. Every region in Michigan has seen an uptick in coronavirus cases in the past 3 weeks. A quote from the governor, quote, COVID-19 has now killed more than 6,000 people in the state of Michigan, Whitmer said in a news release. Continued on, that's more than 6,000 of our parents, grandparents, friends, and neighbors. And the rising numbers we've seen over the past few weeks prove that this virus is still very much a real threat in our state, and closed quote. So Governor Whitmer, no surprise there, really, Ronnie, that the state of emergency was continued on. We're still very much in the thick of this pandemic and dealing with this public health situation in the state of Michigan, in the Midwest region, and all throughout the United States as well. So Governor Whitmer extending her state of emergency, not really a big surprise, but now it's, of course, extended through August 11th.
I think I saw yesterday on the news where they were saying we are basically going to be in this state for at least the next 6 months, if not possibly a year. So I remember, Tyler, when all of this started, thinking in the beginning, remember it was 2 weeks. Hey, we're going to do this for 2 weeks. And then it was another 2 weeks. And then it was another 2 weeks. Here we are, how many months into it? And they're saying, look, this is not going away anytime soon. And I know back, was it 2002, 2003 with SARS? SARS didn't hit the United States as badly as it did Asia, but SARS tended to just go away after like 6 months. And I think that's what they thought was going to happen here. If you remember in the beginning, it was like, oh, the warmer weather is going to take it away. COVID-19 is not going away, and it looks like this is something we are going to have to deal with at least for the next 6 months, if not year.
Yeah, and it's one of those situations where you have a novel virus that doesn't entirely behave like that of a set in place virus like maybe SARS was, and maybe I'm speaking incorrectly. I'm not in any way an expert on SARS, but and even on top of that, in terms of forecasting when we're going to be out of all of this, I kind of take it as a situation kind of like when I was back in school and I was thinking about whether or not we were going to have a snow day, and I always took the angle of, if I deny it enough, it's gonna end up positive. So if I say, okay, no, there's no way. It's only 8 inches of snow and deathly road conditions. They're not gonna give us a day off. 9 times out of 10, it ended up happening. So my thought here is, okay, let's estimate the worst case scenario, and then let's say that worst case scenario, in terms of how long this is gonna go on for, is another 6 months to a year. Maybe then it takes 4 or 5 months, we have a vaccine, we're out of it in 6 months. Or maybe it takes 6 months and we're out of it in 8 with a vaccine. Who knows? At this point in time, it's not really possible for people like you and I who aren't in the medical field and don't have that inside information as we're researching this to know that information. But I think when we all got into this, we had a very unrealistic idea of what the timeline was going to be. And now we're kind of realizing more as time goes on that, okay, another month of the state of the emergency, kind of par for the course, not something we should all be too surprised about or too angry about, because we know we're well over a month away from that. And if anything, it is a very generous estimate when you extend for 1 more month ahead.
My guess is it will be extended past this August 11th deadline as well. It will be extended again. And this will continue on. And keep in mind, there are still legality issues that are going on. People are challenging her state of emergency powers and what they mean and how far they can go. That is still working its way through the court system. But in the meantime, she's still exercising that right to do so.
Michigan's coronavirus cases have now topped 70,000 in the state of Michigan. Health officials confirmed 6 coronavirus deaths on Tuesday and 584 new cases of COVID-19, as the tally of known infections since the start of the outbreak in Michigan has exceeded 70,000. In addition to the 584 new cases on Tuesday, the state reported 82 probable cases as well. Infections are still on the rise, with the state recording a 7-week high for new cases last week, with a total exceeding 3,400 new cases. The 7-day average of the new coronavirus cases is up to 495 daily from 394 for the previous 7-day period, according to state data. The U.S. Department of Health and Human Services has zeroed in on the Grand Rapids area in particular as an emerging hotspot, and having family out in the Grand Rapids area, having had immediate family that lives in our local area that's traveled out there just for a day to be on the beach or be in the cooler weather, they do see that there's been a little bit less mask wearing, a little less emphasis on social distancing on the west side of the state, where the virus hasn't really hit as hard over the course of the pandemic, and now they're kind of seeing the consequences of that. Right now, they're definitely taking it a lot more seriously, as the Grand Rapids area and other areas on the west side of the state have seen a bit of a spike. But in terms of those numbers, yesterday we were back in, I believe, we were back in around 300 or so new cases, 384 new cases on Monday going into Tuesday, and now Tuesday going into today, we are on 584 new cases. So again, it goes back up around that 600 number that really caused concern for the state of Michigan last week, and led the governor to make a couple more decisions on top of extending the state of emergency to really push forward the response.
I will say I was surprised the number wasn't higher, because we're about 2 weeks out from the 4th of July and that holiday weekend when we did see so many people gathering in large groups out on the sandbars and partying at the bars and the restaurants. I'm a little surprised that number's not higher. But the governor is expected to hold a press conference today at 3 o'clock, and we can expect that she is going to address this as well as the her executive order about wearing masks. So more will come out today at 3 o'clock. But given that we're coming out of the 4th of July holiday, and don't they say it's about 2 days to 14 days when you're going to start to see the symptoms, I would even expect in the next week or so that number could continue to rise as well.
Yeah, I would expect the cases to remain around 600 on most days, and in the high 300s, low 400s on maybe, let's call it a good day for now, at least in the over the next week or so, as we are getting those results in from the 2-week incubation period from the 4th of July holiday weekend and just a little bit before and after that. Other news making headlines today at civiccentertv.com/coronavirus. The mask alert prompts legislation by GOP leaders after Governor Whitmer sent a statewide emergency alert to Michigan residents informing them of the new requirements to wear masks. Republican lawmakers are planning to introduce bills to limit what the emergency alert system can be used for. It includes Senators Peter Lucido from Shelby Township, Representative Bradley from Zeeland, and others plan to introduce legislation next week that would restrict the statewide emergency alert system to time-sensitive emergencies or natural disasters. Both lawmakers said they were concerned Governor Whitmer was using the statewide emergency alert system to inform residents of COVID-19 related executive orders, and that goes too far. Quote, "This is an overt abuse of service designed to alert people of legitimate emergencies. The governor has gone beyond the scope and intent of the law and is now somewhere over the rainbow approaching Oz," Senator Lucido said in a statement. The alert in question was issued Monday afternoon and informed cell phone owners in Michigan of Whitmer's executive order requiring individuals to wear masks in indoors, public spaces, and in outdoor spaces where they can't maintain a 6-foot social distance. So this definitely was a little bit of a surprise to get that emergency alert on Monday. That I can't agree with. That I was definitely thrown off by a bit because we haven't gotten those, at least since the stay-at-home order was put in place, and that was more of a statewide immediate and overarching emergency situation being put into place in that moment. This, I don't entirely know that it required an emergency alert, and definitely our state legislatures, particularly on the Republican side of the aisle, disagree with the governor's decision-making.
I was so happy I wasn't driving when that alert came across because I jumped out of my seat when it happened. It's so loud, and when you're not expecting it, it's like, oh my goodness. So can you imagine if you're driving down the road and it comes across your phone? It's like, woo! But yeah, so we'll see how this moves forward, but we are seeing an increased, there are so many tensions surrounding the use of masks in public now, and we're seeing increased cases of violence sparking out of this. So did that mask alert kind of help push those tensions over to that other side? Something we're going to have to just live with, and we're going to see more of these cases coming forward, but it's a weird time in our country right now.
Very much a weird time in our country, definitely a weird time in our state, and all those headlines and more on civiccentertv.com/coronavirus. Go to our homepage, click on the coronavirus link at the top of the page, or you can scroll over to it in a side menu on your mobile phone. If you go to our website, civiccentertv.com, click on coronavirus, and you can get all of that coronavirus information and other major local news that's affecting the Oakland County area. News like, of course, the new mask order and other emergency situations that happen in the Oakland County area that affect our local businesses and affect our local law enforcement as well. And joining us now to talk about the new mask order and how local businesses are faring with this new rule is Captain Dan Edwards from the Bloomfield Township Police Department. Captain Edwards, thank you for being with us today.
Thank you for having me on today.
Appreciate having you with us. How are you? How are your officers doing?
Well, I am doing well, and our officers are doing their job every day.
It's very nice. So Governor Whitmer issues a new executive order requiring masks to be worn in all indoor spaces and crowded outdoor spaces as well, where social distancing measures cannot be put in place. Obviously affects local businesses, in particular retailers, places of work, and restaurants and so on, as they are now required to not admit people into their facilities without wearing a mask, and are also ordered to reject service to those people if they refuse to wear their masks. Any help that your department has done either last week after it was announced that it was going to go into effect on Monday, or since Monday when it has gone into effect, to help these businesses prepare to put their best foot forward to enforce this rule without putting their business or the safety of their patrons at risk?
Well, Tyler, you've obviously done your homework. You stated the law exactly correctly, which is good, and that everybody's aware of what the law actually is. The Michigan Department of Labor is the one that actually is in charge of overseeing that the businesses put the signs out correctly and that they're enforcing that. Obviously, anytime that there's a issue with the community, having a disagreement or anything, we are called in, and we've told all of our businesses and our residents, we want to make sure everybody knows that we will respond anytime somebody calls. We've had very few calls to these types of incidents, which I understand is kind of unusual. A lot of other jurisdictions have had a lot of calls for troubles with customers that are refusing to comply or refusing to leave. But we've been very lucky. We've only had a couple calls of people with concern of this. But when we go to these calls, what we do is what we've done from the very beginning. We're approaching it from, it's a health and safety issue more so than a law enforcement issue. And we go there to help educate the public what the laws are and what they should be doing and the reason behind it. And we're looking to get voluntary compliance from them rather than taking enforcement action. And from the beginning, we have issued 0 citations to people, and that's our goal, is to continue to do that just through education and voluntary compliance.
Captain Dan Edwards from the Bloomfield Township Police Department with us. So in that case, is Bloomfield Township taking more of the angle? There's been some sheriff departments that have said, we'll enforce the law. We'll go and, of course, assist these businesses if they're having trouble with people not complying with the new executive order requiring masks to be worn in many social situations and public situations. But we're not necessarily going to issue any fines or tickets for doing so. Many sheriff's departments in the state of Michigan have already made that statement. Is that kind of the angle of the Bloomfield Township Police Department as well, where we're not necessarily going to issue a citation necessarily and issue a fine, but we're going to educate you on it and at least hope that if we don't see you again for a similar situation where we would then have to take more corrective action?
I think politics are being interjected way too often in this this whole issue with masks and compliance and all that. And we try to stay as far away from the political part of it as possible. And to say that we're not going to, or we're going to do something, like, our job is to preserve the peace and to protect our community. And that's what the intent of these laws are. And so we're assisting the governor in implementing these laws by, again, educating them and getting voluntary compliance. And luckily, we have not had to issue any citations. We do document incidents, and if it's necessary, we can turn our documentation over to the Attorney General for follow-up later and issuing of the appropriate charges, but we have not done that in any cases yet. So,
and in Bloomfield Township, much like other local municipalities in the Oakland County area, you have a variety of different sizes of stores and eateries and other businesses that are affected by this law. So everybody's going to have to do their part to enforce it or to employ this. It's probably a better wording, employ this new rule in a different way, whether it be have one entrance open instead of 2 and have someone at that entrance, or put up signage when you enter the store to say, hey, here's a mask. If you don't have one, you're required to wear one or we're going to kick you out, and so on and so forth. Have you has the Bloomfield Township Police Department, or even the fire department on top of that with all emergency services in the Bloomfield Township area, been to these local businesses and helped them in any way with arranging how they're going to do that? Because I guess it could be in some ways confusing for some of the smaller stores that maybe don't have as much staff, or some of the bigger stores that have a large surface area and maybe aren't able to be consistently on the lookout. Have you been able to assist them in any way in putting their best foot forward to enforce this new rule?
We absolutely would assist them, and thanks for giving me the opportunity to bring that up. And hopefully some business owners can hear this podcast and call us for resources. We have a community liaison officer that will go out and help them be compliant with that, but it's the Michigan Department of Labor is the one that's in charge of that, to make sure that the businesses are doing it correctly and have the correct signage out. And so it would fall to the state of Michigan rather than to local police departments. But we would certainly be willing to help them. But our businesses have all, they read the laws and get educated with good newscasts such as yourself that are well informed and giving out the correct information. So I appreciate you helping keep our community educated on this.
We thank you and we appreciate that. We thank you very much for that compliment. Captain Dan Edwards from the Bloomfield Township Police Department with us on the Oakland County Megacast. Last weekend, Captain Edwards, there was a public safety incident on I-75 with a tanker that had overturned and that had affected the Bloomfield Township area, create a bit of a hazmat situation. Can you give us any details on that, especially any new details on that situation, what maybe has been learned of what caused that or what led to that or what resulted from that since it happened?
Well, I think the fire chief gave a press release about that incident, and the tanker overturned and leaked 35,000 gallons of fuel, and which caused a big fire. And obviously, we were concerned about the residents in the area of Square Lake and Updike. The HAZMAT team was called out to help contain it, and the dirt is being measured for contaminants now and being dug up. And the fire departments, we have an excellent fire department who has an excellent network of neighboring fire departments, and they handled the incident perfectly and we were there assisting them with directing traffic and making sure the neighbors were notified of exactly what was going on in the community.
Captain, I live in the area, and I have to say thank you guys so much because you had so many updates on your social media. That area was already confusing because of the shutdown of 75 from Square Lake down to 8 Mile. So a lot of people were taking that intersection that would maybe normally not take that intersection. So your updates on your social media were so vital to the community and keeping us updated. It's the first thing I did is I went to your website or your Facebook page. How has social media changed how you communicate with the community and also promote your department?
It certainly is a very useful tool to help us get communicated with our community. It's the instant messaging that gets out there to everybody. And we use several platforms. We have a Nixle, which is something that anybody can sign up for, and our dispatchers immediately put that in there, which is a community. If you sign up for Nixle, you get a text message from the dispatch center about emerging incidents. And that was actually how I heard about it first. And then I checked my Facebook page, and then I saw, where the roads were closed and where exactly it was. And so we do try to reach out to the community and let them know what we're doing and what we're seeing. And follow us on Facebook and you'll get emerging information like that. And also the stuff that we try to do, just the fun stuff and the stuff that connects us to the community to help humanize the face of law enforcement, which we work on doing that.
Captain Edwards, anything else, any other general updates that we should be aware of or things that we should be looking out for in the Bloomfield Township or surrounding areas before we let you go today?
Well, some of the things that I'm proud of that we're working on getting body cameras, which is a big expense for our department. And we're also working on changing some policies and updating our training, which administratively takes a little bit of work. But we're in regards to what's going on in the nation in terms of law enforcement, our de-escalation training and implicit bias training, which we've done that on an annual basis for many years, but we're continuing to do that. And all our officers are going through some de-escalation training this week within our department.
So can you elaborate on that at all? I mean, you mentioned that the department has already been doing de-escalation training and implicit bias training before, usually on a yearly basis, and that there's going to be some changes and some other new training put in place. Can you elaborate on to what extent that is going to be? Is it just going to be more often? Is it going to be different kinds of training, a different method? What does that look like for your department?
Well, some of the updates to our policy is putting a knee on somebody's neck. That is only to be used in a deadly force situation. It wasn't specifically spelled out in our policy before, but now it is. And chokeholds are also specifically spelled out that's a deadly force situation. And also duty to intervene anytime an officer sees another officer using inappropriate force or violating a law or violating somebody's civil rights. They have a duty to not only stop it immediately, but to report it to the administration of the department so that we make sure that we are holding each other accountable. And so that duty to intervene is an important policy for us it's always been our culture, but it hasn't been written down. And you can terminate an officer if they're not intervening and stepping up to that. So we wanted to hold ourselves to that higher standard. And also with the de-escalation, that's been part of our policy for many years, and we're just working on our annual training of it to try as hard as we can. And we're also bringing in all of our 911 operators. So when you call 911, that person will also go through that same de-escalation training.
All right. Well, thank you very much, Captain Edwards, for being with us today.
All right, Tyler, thank you for having me on.
Captain Dan Edwards with us from the Bloomfield Township Bloomfield Township Police Department. I keep making that mistake. I don't know why I have that in my mind today. It's because they work so closely together in these situations with COVID-19 and with the incident on I-75 over the weekend. My apologies. It's from the Dan Edwards from the Bloomfield Township Police Department with us on the Oakland County Megacast on a family of TV and radio stations. We will return after this break and talk about how the pandemic has continued to impact our local business community. You are watching and listening to the Oakland County Megacast on our family of TV and radio stations. Ronnie and I will return after this quick break.
Michigan, we still need to stay careful, because we don't want to go backwards, back to where we started. So keep standing 6 feet apart, keep wearing a mask in public, and if you have symptoms, talk to a healthcare provider about getting tested. To move forward, let's all do our part. So stay careful. Michigan.gov/coronavirus. Michigan, we're calling on you to save lives. Don't ignore it. Don't let it go to voicemail. It's urgent. In fact, it's critical. Because if you've been in close contact with someone who tests positive for COVID-19, you may have been exposed to the virus. And you could get a call from My COVID Help or your local health department. So please answer the call to learn how to protect yourself, your family, and friends. We're calling on you to stop the spread of COVID-19, to make it safe to reopen businesses and help Michigan move forward. So if you get a call from My COVID Help or your local health department, you may have been exposed to someone with COVID-19. To protect us all, answer the call. Learn more at michigan.gov/containcovid. A message from the Michigan Department of Health and Human Services.
Welcome back to the Oakland County Megacast. I'm Tyler Keefe alongside Ronnie Dahl in the studios of Civic Center TV and 89.3 Lakes FM. In addition, we are on Birmingham Area Municipal Access and 88.1 WBFH, the Biff out of Bloomfield Hills High School, with leadership from station manager Ron Whittables with us each and every day on the program. In addition, today our Facebook partner is West Bloomfield Parks as we continue to celebrate Parks and Recreation Month in the month of July. We thank them for joining us and encourage you to get out to your local parks in West Bloomfield and all throughout the Oakland County area this week, next week, and beyond as we celebrate Parks and Recreation Month, even in the midst of a pandemic where we've seen a lot of challenges for Parks and Recreation departments and for general recreation activities in the local area, including businesses that support these local recreational activities or hold these recreational activities. It's been a challenge for business and commerce all throughout the local area since the onset, and they continue to have to tackle new challenges and do so in really creative ways. And to talk about some of those methods that they've been using and their adaptation, as well as some local programs that are in place to help these businesses continue forward, we are now joined once again by Executive Director of the Greater West Bloomfield Chamber of Commerce, Suzanne Levine, with us on the Oakland County Megacast. Suzanne, thank you for being with us.
Good morning. How are you all today?
Doing well. How are you, Suzanne?
Good, good.
So how have the businesses in the chamber been holding up? We talked earlier on in the pandemic and about midway through where we're at right now about where they're at, and those are different stages where the shutdowns were in place and everybody was curbside and everybody was online ordering only, and then at a point where some are starting to slowly but surely reopen. Now we're at a point where everybody's kind of got their feet under them. They're kind of in motion and dealing with this pandemic normal of operating their business, but there's still some new challenges that are in place. How are our local businesses in Greater West Bloomfield holding up?
Well, they're managing. I mean, some are struggling more than others. Certainly, the nail and hair salons are having more of a difficult time because they have to limit the amount of people they can have in there. And of course, there are people that may never go back, to their favorite salons. So I'm trying to do whatever I can to try to help them navigate this, what they call new normal, but I call it the abnormal. So it's been very challenging, trying to figure out what works and what doesn't. I know that several stores have tried like sidewalk sales to try to bring customers in. They're advertising, they're trying to offer, better deals. But, on the other hand, like the restaurants are struggling because even though there's a lot of carry out business, when it's 90 degrees out, no one really wants to eat outside.
Suzanne Levine with us. She's the executive director of the Greater West Bloomfield Chamber of Commerce. So in that case, when you have all these challenges, part of the way that you can, as a chamber or as any local organization or any business, overcome that is to educate yourself, to find new ways, to be a little bit, to educate yourself and then use that education to foster creativity and find another way through the situation. The chamber does this in regular times when there's other challenges in place that are not pandemic related. Right now, what are some of the programs? I know there's some educational programs, but beyond that, that the Greater West Bloomfield Chamber of Commerce has in place to help these businesses navigate this current situation?
Well, we've taken all of our specialty programs like our senior resource group, our young professional entrepreneur network, our women's inspiration network, our business innovation generator, and we've taken them virtual because these are great networking opportunities and to remind other businesses that they are viable and they're there to, network and connect. I've tried to, as a business matchmaker, I have tried to connect like-minded businesses with one another. For example, we had a young pizza entrepreneur, and I connected him with several real estate agents and said, perhaps when they sell a home, they can let him know and he can deliver a free pizza. Welcome to the neighborhood. So trying to think of different ways that people don't have to spend money, but they can collaborate with one another to promote their individual businesses. We are going to try to do some hybrid events because there are some people that are clamoring to get out there. They want an in-person event, but then we know there are other people that are fearful of that. So trying to figure out how I can navigate, for example, our very successful health fair and take it virtual, as well as have like a limited opportunity for people to be in person, either with a table as a vendor or people to come in and learn about their business.
Suzanne, I love that you guys are doing this and how you're bringing the different businesses together. Prior to this, one of the things you would notice, businesses that would operate in what I will say kind of the old school way didn't really embrace technology, social media. How important is it for them to be able to shift into this new platform, and how are you able to change their mindset and teach them that this is what they need to do to keep their revenue flowing?
Absolutely. I've always been of the mindset that you can't rest on your laurels, that I've constantly tried to reinvent the chamber because, first of all, competition is never going away. And I've tried to explain that. We could have 50 real estate agents or nail salons in our chamber and they're not going to go away. So you have to figure out what makes your business unique. I think we've been very fortunate because we have a really great social media marketing expert on our team, Vito Kukuru, and he teaches Google classes, and these are free to just about anyone. It's not just our chamber members, and it's how to utilize email marketing, how to make sure that you have a social media presence, because we know people aren't necessarily going to go just walk into your store anymore. They want to know what they can offer. Do you have curbside? Can you do some sort of video presentation of what's in your store and maybe even home delivery? So everyone has to figure out what makes their business unique, number one, and how they're going to get the word out about these great things that they offer if they want to stay vibrant. I think we're all trying to figure out, what works and what doesn't, but they definitely, social media is beyond the new business model that everyone has to embrace. Attend Zoom meetings. I know people are kind of getting zoomed out, but it's just a great way to network with other people and let them know that your business is still viable and vibrant, and that you're willing to do business with people.
Suzanne Levine with us. She's the Executive Director of the Greater West Bloomfield Chamber of Commerce, with us on the Oakland County Megacast. So communication through social media, you mentioned the importance of that. And earlier on, you mentioned you are a business matchmaker, as you called yourself. In times like this especially, how important is collaboration, communication between businesses, partnership between businesses for their mutual success?
I think it's beyond critical. I've even collaborated with other chambers because I don't really see them as competition. I see that, we can pool our resources and try to have some events that benefits the entire community. So I think that people need to realize that you can't just be for yourself anymore. And as I say, what worked in the past, unfortunately, is probably not going to work today or even in the future. People have to be aware of, what might be future trends of business. We know that online business has really skyrocketed because a lot of people really are still fearful to go into stores, masks and all. So I think that's really important. I think the other thing that businesses have to realize is that your frontline workers, the people that do business when you first walk into a store, they will decide whether your business is going to be successful also. One bad interaction does more damage to your business than all the amount of advertising and great sales. So they need to train their frontline workers to be patient and kind and respectful because everyone is pretty stressed out right now. So that's really critical also to be able to train your employees that how to treat other people.
We have seen business shift. So our typical brick and mortar stores are maybe suffering the most, but I would imagine there are some businesses that are exploding during this pandemic. As a business expert, what areas do you see growth in going forward?
Well, definitely anything that's food related. The grocery stores, I know that some of our members like Plum Market has seen a total explosion of their, revenue because people don't want to go to a large supermarket. They want to go someplace, even if they're paying a few more dollars, to feel like they're a little bit safer. I noticed that our local UPS store has really seen an explosion because people might not want to go to a post office. I think I know that some of the smaller boutique stores, if they can offer, personalized service, maybe curbside or home delivery. I know that they were doing that for some of their clients. I think that is another growth avenue because people don't want to go to a mall. They don't want to walk into a large retail operation. So, and especially the small boutique stores, they know their clientele. They can say, oh, I just received this new merchandise. Let me show it to you. So I think in having the people be able to try it on at home and then bring it back. And then of course, I think it's like 72 hours of, keeping it off the shelves and racks, and letting them know that they're trying to do everything they can to make the experience pleasurable and safe.
Suzanne, there's been a lot of also aid that's been put out there for local businesses and small businesses, especially, definitely on the federal level early on, and then now locally. There's some more programs that are already in progress or have already been completed by Oakland County. There's more aid programs that are in progress from Federal CARES Act dollars. Same on the state level, where we talked last week to Brian Calley from the Small Business Association of Michigan. We've also spoken to other local chambers about some of these aid dollars that can get businesses up to $20,000 a pop in state and federal CARES Act aid. How critical is this aid money to our local businesses? What is the chamber doing to help them receive those dollars, and where are those going to be put to use, particularly in the Greater West Bloomfield Chamber of Commerce, but also otherwise?
Well, I know that oak.gov is constantly updating. Oakland County has some other new programs, and I've tried to, as I say, reach out to all of our members, and I'm going to do like a follow-up call now to see how since they've reopened, how they're managing, and do they have the proper PPE equipment. Oakland County had a great program where they were distributing these great small business toolkits, and anyone could basically qualify to get them. And they had masks and instructions, and they had thermometers and all kinds of really great things that they were offering to help small businesses get back on their feet. I know that the PPP not everyone can qualify for that. A lot of nonprofits like chambers cannot qualify for the PPP. I know there's talk about extending certain grants and loans. So it's best if they can contact me, or they can go to Oakland County, oak.gov, and look at all the new programs, because every day there's a new program with new criteria. There's one for entrepreneurs. I think there's one for nail salons and gyms, because they're at the most risk right now. I know gyms are still not open. I know they're trying to do things like offer classes online for a small fee, or holding classes outside. But I expect that we're going to see some of these small businesses not survive if something doesn't happen soon.
Suzanne Levine with us on the Oakland County Megacast. She is the Executive Director of the Greater West Bloomfield Chamber of Commerce. Suzanne, before we let you go today, just a couple more minutes, anything else that you want to touch on today, or any other information that you believe would be important for our audience to know?
Well, the chamber's here for them, so please call me. I'm happy to strategize. We have, as I say, our social marketing expert, Consult Vito, who's phenomenal. And between the two of us, we can help them, figure out a plan. I know that Oakland County has that one-stop business, and they're very happy to help guide small businesses, try to figure out a business plan, or what their next steps are. So there are resources for people. If they don't know how to access them, please contact westbloomfieldchamber.com. You can go to our website. You can contact me personally at wbloomfieldchamber@gmail.com, 248-626-3636. And even if you're not a chamber member, I'm really happy to help, because I feel it's my mission to try to help businesses stay in business as long as they possibly can.
Well, Suzanne, thank you very much for being with us today.
Thank you.
We appreciate it. Suzanne Levine, the Executive Director of the Greater West Bloomfield Chamber of Commerce, with us on the Oakland County Megacast. And it's really interesting, Ronnie, as we continue to talk to different chambers, the different perspectives that each of them are taking. A lot of them are focused in different areas, and they're collaborating with each other, as we've heard from Suzanne. So maybe one like, we tend with Birmingham Bloomfield's chamber to be more of, okay, how can you best implement this, that, and the other, and how can you get the federal and the state and the local aid dollars as much access as possible and put them to the best use, whereas Suzanne's chamber in West Bloomfield is more typically tailored toward networking and to communication and collaboration, and putting all those chambers in our local area, their heads together, has to be something that's really important, especially right now, but probably will continue to be something really nice and really important for the success of our business community going forward, even after the pandemic.
It's such a wealth of knowledge that they have at their fingertips, and they want to share with our business community. So even businesses that maybe are not a part of a chamber, like Suzanne said, still reach out. There are resources that are out there, and it's just a matter of you actually not only knowing about these resources, but how to utilize them and to, get in on what's going on. So like she said, I'm a business matchmaker. So you don't necessarily have to be a part of a chamber to know or to learn about some of these resources that are available. So we urge everyone that is out there to go ahead and do that. Even the new businesses that are coming on board at this point in time, you want to go ahead and, learn what is out there, because you want to succeed. And we need you to succeed as members of a community, because we need these businesses in our community. We were talking the other day about what would happen if so many of these brick and mortar stores actually went away. And I'm an Amazon shopper. I like, getting things delivered to my front porch. It is quick and it is easy. But there are a lot of times where you just need to go to a store to be able to purchase whatever you need. And so if these brick and mortar stores go away, which are already starting to struggle prior to the pandemic, if they continue to close up and go away, where is that going to leave us in our community? There is going to be a gaping hole there where we're not going to be able to get the goods and the services that we actually need. So support them now at this point in time. Businesses, if you are out there and you feel like you're on an island and you're overwhelmed with what's going on, utilize your local Chamber of Commerce. Check in with them, even if you're not a member, to see what resources are available to you and capitalize on them at this point in time so that you can keep your doors open.
It's going to be really important that you continue to adapt as a business, and as Suzanne was talking about, continue to network and communicate with other businesses. And I think on top of what you were saying, Ronnie, about collaboration and about innovation during this, that continuing that conversation, even if you're not a chamber member, with these local businesses and these local chambers is going to be so vital, because I think above all else, the business community in Oakland County and maybe even beyond Oakland County as well are really focused right now not only on looking out for number one and, of course, keeping their business open and functioning and still viable for the future, but keeping the greater business community also alive and well on top of that, because if the local economy isn't strong, people aren't going to go out and buy products. They're not going to go out and patronize local businesses, and that's going to hurt everybody involved. So whatever help you can provide to other local businesses and whatever help you can get from other local businesses through that communication is going to be so incredibly important. Well, transitioning yesterday, Oakland County Executive David Coulter, as well as the Board of Commissioners Chairperson David Woodward, Oakland County Clerk and Register of Deeds Lisa Brown, and others held a press conference from the Oakland County Circuit Court's Elections Division Bureau, talking about some new initiatives coming into play for the 2020 election season. And among the concerns about in-person elections and a lot of concerns for election workers is whether or not they're going to be able to be safe as they are working on election day. David Coulter yesterday, the Oakland County Executive, briefly explained some of the ways in which the county is going to provide a safe environment for our local election workers.
We know we have to have enough election workers, and that those election workers need the right technology to do their jobs and to count these ballots, especially the absentee ballots. And we don't want them to be overwhelmed. We want to assist them where we can to get these elections done right. Elections are vital to our democracy, and the timely and accurate reporting of those elections is critical to the confidence of our voters. Election workers need PPE, and so we need to outfit them with the tools and the equipment that they need to be safe during the elections.
That was County Executive David Coulter yesterday from the Oakland County Circuit Court, talking about providing safe environments for our election workers. But you're not going to have safe environments for election workers be effective if you don't have enough election workers to make the elections happen. So Melanie Hollis, the clerk of the city of Royal Oak yesterday, also spoke at the press conference about some ways in which her city and maybe other cities will incentivize bringing new election workers into the fold for the 2020 primary in August and the general election in November.
The first thing that the advisory council did was we did a survey to all of the Oakland County clerks in the area to see what was important to them to make it so we would be able to have whatever help they need for the elections. And one of the top things that all of our concerns is election workers, because a lot of us have a lot of seniors that have always worked the elections for us. But obviously with COVID right now, there's a lot of concern and they're not as comfortable working this election, and that's fine. But now we have to look for new things to recruit. So one of the things that we had suggested was like an additional kind of a appreciation bonus for August and November. So we're recommending that there's an additional $50 for each worker that's paid. And we're hoping that that will definitely recruit some more people.
So definitely there's a concern. There's always been one going into a lot of local elections with new election workers coming in, particularly younger election workers, and especially during this pandemic, Ronnie, as we are faced with the elderly in our community and older individuals in our community being more susceptible to COVID-19. Even with the safety measures, they're at an increased risk. So maybe that makes them a little more apprehensive, or those that are perennial election workers maybe hold back this year and in this election cycle. There's definitely a big need for more election workers and whatever they can do to incentivize bringing more people on to experience that paid position and do their civic duty. I think it's a good effort.
And if we have more and more people that are still unemployed during that time, this may be a good way for them to get involved with the community and support their community. This pandemic is going to do one or two things, I think, Tyler. It's either going to keep people home, or it's going to really prompt a lot of people to understand the importance of our democracy, and it's going to bring them to the polls. So I think we'll see an explosion, though, of the poll numbers and the number of people who are actually going to get out and vote this year. We've seen that with the surge of protesters that have been out and about during this pandemic and following George Floyd's death. And a lot of people are urging all of those protesters to have their voices heard, not just on the streets at the protests, but also at the polls. That's where you're going to make the biggest difference, is by getting involved and helping to change the policy. So if we get all of those protesters to vote, and then on top of that, that's going to increase the number of the younger people getting involved in our democracy, but also the people who are upset about the pandemic and how the pandemic is being handled. We're so polarized right now. I think that is also going to spur a lot of people to get to the polls. So that's why we're going to need to see more people volunteering at the polls to make sure our lines aren't so long that it deters people and it turns people away from actually casting their ballot.
It's going to be an ongoing scenario with us, an ongoing story. Will we have enough election workers for in-person polls this fall, and to accommodate for all the absentee voters that will be voting from their homes or from other locations and sending in their ballots this year? It's still yet to be seen, and hopefully that will be something that will be taken care of as this democracy initiative being put forth by Oakland County is put into place. Ronnie and I will return after this quick break and have more for you, including a report from Erica Jones out in the field. You are listening and watching the Oakland County Megacast on our family of community TV and radio stations.
Hi, I'm Dr. Jonay Khaldun. I'm the Chief Medical Executive for the Michigan Department of Health and Human Services. The people who are at highest risk of getting severely ill from COVID-19 are the elderly and those with chronic medical conditions. That includes people with heart disease, diabetes, COPD, or those who have compromised immune systems. People who are in those categories should right now be staying at home as much as possible and not going out if it is not essential. If you fit into one of those categories, those are the things you should do. And if you have a family member who fits into one of those categories, you should be checking in on them and making sure they are following those guidelines. There's something everyone can do to protect the community from COVID-19.
Hi, my name is Kurt Lawson, and I'm the Public Information Officer for West Bloomfield Township. We wanted to reach out to you, our older adults, to provide information that you may find useful during this difficult time. We want to ensure you that West Bloomfield Town Hall, our Waters and Utility Department, West Bloomfield Parks, and our police and fire departments continue to work hard on your behalf. Information and resources can be found on the Township website, the police Facebook and Twitter, or call West Bloomfield Park's COVID-19 Help Hotline. Please remember to keep your social distance of at least 6 feet, wear facial coverings when you leave your home, and wash your hands for at least 20 seconds with soap. These precautions will help keep you safe during these difficult times.
Welcome back to the Oakland County Megacast. I'm Tyler Keefe alongside Ronnie Dahl in the studios of Civic Center TV and 89.3 Lakes FM. In addition, we are on Birmingham Area Municipal Access and the Facebook page of the West Bloomfield Township Parks and Recreation Department, West Bloomfield Parks, on Facebook today, as we are each and every day with a Facebook partner. We appreciate having West Bloomfield Parks with us today as we continue to celebrate Parks and Recreation Month in the month of July in the state of Michigan and all throughout the United States, as people are looking to get back outside during these nice weather months and are looking for some activity that they can do with their families, with their friends, with others that is safe and that is abundant. And we have so many great natural areas in our local area here in Oakland County. So many great parks departments, not only in West Bloomfield with our partner today in West Bloomfield Parks, but in other locations as well throughout the Oakland County area. Different parks departments that are doing excellent work and have different programs in place. So we appreciate West Bloomfield Parks being with us today on the Oakland County Megacast as we continue to bring you all the latest local news and information from throughout the Oakland County area. We have Erica Jones out in the field as the mask-wearing law continues on for its third day in effect after Governor Whitmer put that new executive order in place into law on Monday officially. Erica Jones now with us out in the field at a big local store. Erica, where are you at in the local area?
Hey Tyler, I'm at Target, but today's report looks a little different actually because unfortunately we had some customer complaints, so I wasn't able to do a report from inside the store or even in the parking lot. So we are in my car today. But I did get the opportunity to go inside and see how they're regulating this new order. They have a guy standing when you first walk in. He has a little stand. He's wiping off carts, which they've had throughout this whole pandemic. And he's also regulating, making sure that everyone is wearing a mask. And they do have masks that they're handing out. So if someone walks in without a mask, they will hand them one. And I think that's great for business because that way, if someone's not wearing a mask, they don't just need to kick them out, which obviously will hurt their business, so they can hand them one and then they can continue shopping. And he told me that really everyone has been very compliant. There hasn't been a single person that has had a problem with it, which I was honestly very surprised with and glad to hear. He said there's just been a couple people that have said they've forgotten their masks and then they've handed them one and everything's great. And also the lady that came and kicked me out of the parking lot told me that they haven't had any problems either. So it seems like at Target, things are going very well. Very pleasantly surprised to hear that.
Yeah, at those big box stores, you kind of have a concern, too, because they usually have multiple or several openings. I've seen at some local grocery stores, at least, that they've closed down one entry or other entries and limited to one single entry with someone at the door to make sure people are coming in and wearing their masks. Is that the case at this location, Erica, or was it multiple entrances with multiple people from what you saw and experienced?
Yeah, well, this Target actually only does have one entrance, so that definitely makes it a lot easier for them. The guy that I was referring to earlier is just standing at the one entrance when people first walk in. So I don't think they had that issue specifically here, but I have heard from other people that have been out to other big box stores like this that they are blocking off several entrances and they're only letting people in at one entrance because that way it's easier for them to just have one worker standing there regulating it and they don't need to have people at every different entrance.
Well, Erica, anything else to report on out in the field today?
Nope, just that. I think that this order is going pretty well from what we saw yesterday with smaller businesses and even today at a larger one. I was a little concerned about how it would go because, you know, these larger businesses are where we see people getting angry, even violent sometimes, unfortunately. But, you know, based on what Target said, it seems like things are going very well. And
it does seem like generally in our local area that people have been very compliant and have been at least, if not compliant, respectful of the new order. Erica, thank you very much for that report. We appreciate it. We're going to take another quick break, and we'll come back and review today's top stories and continue to talk to local experts and interesting people from throughout the community to continue to tell you the stories of Oakland County's people, businesses, places, and activities during the coronavirus pandemic and other top information. You are watching and listening to the Oakland County Megacast on a family of TV and radio stations all throughout the local area.
Michigan, we're calling on you to save lives. Don't ignore it. Don't let it go to voicemail. It's urgent. In fact, it's critical. Because if you've been in close contact with someone who tests positive for COVID-19, you may have been exposed to the virus. And you could get a call from My COVID Help or your local health department. So please answer the call to learn how to protect yourself, your family, and friends. We're calling on you to stop the spread of COVID-19, to make it safe to reopen businesses and help Michigan move forward. So if you get a call from My COVID Help or your local health department, you may have been exposed to someone with COVID-19. To protect us all, answer the call. Learn more at michigan.gov/contain-COVID. A message from the Michigan Department of Health and Human Services.
Welcome back to the Oakland County Megacast. I'm Tyler Keefe alongside Ronnie Dahl and our family of TV and radio stations on Comcast, Channel 15 and AT&T Channel 99 on Birmingham Area Municipal Access, or BAMA, as it's known, in Birmingham, Bingham Farms, Beverly Hills, and the village of Franklin. In addition, we are on Civic Center TV, which is also on those same TV channels and is on CivicCenterTV.com. You can click on our Watch Live link and watch us live in high definition each and every day on the program, as well as our other original and imported programming and municipal meetings as well. In addition, we are on a variety of community radio stations, including 89.3 WBLD, Orchard Lake, West Bloomfield, Keego Harbor, Sylvan Lake, and 88.1 WBFH, Bloomfield Hills. That is 88.1 WBFH, The Biff, a service of the Bloomfield Hills School District, with operations out of Bloomfield Hills High School under the leadership of station manager Ron Whittables. And we thank them for being with us each and every day on the Oakland County Megacast as we bring you the top stories from around the local area on coronavirus and other stories. Today, our top headline, Governor Whitmer has extended Michigan's state of emergency through August 11th. The state of emergency does not place any restrictions on Michigan residents, but it allows the governor to issue executive orders that place such restrictions, such as current orders against gyms and theaters being open in South and Central Michigan, restricting occupancy at dine-in restaurants and requiring face masks in public indoor spaces and crowded outdoor spaces as well. The state of emergency had previously been scheduled to expire this week. Every region in Michigan has seen an uptick in coronavirus cases in the past 3 weeks. A quote from Governor Gretchen Whitmer, quote, "COVID-19 has now killed more than 6,000 people in the state of Michigan," Whitmer said in a news release. She continued, that's more than 6,000 of our parents, grandparents, friends, and neighbors. And the rising numbers we've seen over the past few weeks prove that this virus is still very much a threat in our state. Governor Whitmer said that in a news release this week as she released her mask order, of course, on Monday and extended the state of emergency yesterday through August 11th. We're still very much in this situation, and there's a long way to go. So, again, no surprise from the governor's side that this order has been extended out a little bit, and it's going to go through August. As we know that by the time we get to August, get through the August 11th especially, we're probably going to have the extension go forward another month or two beyond that.
I know a lot of people probably feel like we're talking so much about the coronavirus and COVID-19, but this is impacting every single facet of our lives. And Tyler, it's not going away anytime soon. So we're trying to keep you up to date with the latest news because it does change day by day, hour by hour. So it's important for all of us to understand all of these changes. So with her doing this, extending the state of emergency, understanding when we hear state of emergency, I think we automatically just think it's the shutdown notice. Those are two totally separate things. But it's important to understand what the state of emergency is, why it's put in place, and the powers behind the state of emergency. But this, once again, isn't saying we're shutting down the state. That's different. This is a state of emergency. However, it does give her the powers to do so. Remember, we thought we were going to probably be in phase 5 by the 4th of July weekend. We're past that time and we're still in phase 4. But the state of emergency does give her the power to make those decisions as needed as we continue to move through this pandemic.
State of emergency extended by Governor Whitmer through August 11th. In addition, yesterday, Michigan's coronavirus cases reached the point of 70,000. They have topped now 70,000 total cases during the pandemic. Michigan health officials confirmed 6 coronavirus deaths on Tuesday and 584 new cases of COVID-19 as the tally of known infections since the start of the outbreak exceeded 70,000 cases. In addition to the 584 new cases confirmed yesterday, the state reported 82 probable cases. Infections are still on the rise, with the state recording a 7-week high for new cases last week, the total exceeding 3,400. The 7-day average of new coronavirus cases in Michigan is up to 495 daily from 394 daily from the previous 7-day period, according to state data. The U.S. Department of Health and Human Services has zeroed in on the Grand Rapids area as in particular as an emerging hotspot in the state of Michigan. So we're still seeing a little bit of an uptick continue on with these new cases. It leveled off and dipped a little bit back down to around 400 cases a day over the last several days, and now back up around 600. That was a cause for concern last week as we had a few consecutive days of those numbers. So the spike still continuing on. No indication exactly from this article necessarily of the age group in which those new cases continues to be from, but I would presume it still is in that 20 to 34 category that we've seen in recent times.
And that is one of the reasons, too, that we're not seeing the number of deaths rise like we did in March and April, is because it does tend to be hitting that younger demographic. However, keep in mind, the younger demographic can also spread it. So while maybe their immune system can handle the virus, it's not always the same case for all individuals in that age group, nor for the people that they're coming in contact with.
More headlines at civiccentertv.com/coronavirus. The mask alert prompts legislation by GOP leaders. After Governor Whitmer sent a statewide emergency alert to Michigan residents informing them of the new requirement to wear masks, Republican lawmakers are planning to introduce bills to limit what the emergency alert system can be used for. Senator Peter Lucido and Representative Bradley Slay plan to introduce legislation next week that would restrict the statewide emergency alert system to time-sensitive emergencies or natural disasters. Both lawmakers said they were concerned Whitmer's use of the statewide emergency alert system to inform residents of COVID-19 related executive orders goes too far. Quote, "This is an overt abuse of a service designed to alert people of legitimate emergencies. The governor has gone beyond the scope and intent of the law and is now somewhere over the rainbow and approaching Oz," Senator Lucido said in a statement. The alert in question was issued Monday afternoon and informed cell phone owners in Michigan of Whitmer's executive order requiring individuals to wear masks in indoor public spaces and outdoor spaces where they cannot maintain a 6-foot social distance and they're in a bit of a crowd. So, of course, with a new executive order, there is new opposition. In this case, the opposition comes not necessarily with the executive order in this case, but with the ways that executive order was announced to the general public through use of a emergency alert that came into all cell phone users in the state of Michigan simultaneously.
Like you said yesterday, one of the things is around that same time, there was an Amber Alert that was issued as well. And so hearing those alerts back to back basically did get your pulse jumping, like, oh my goodness, what's going on? And then when you saw it was about the mask, I think that was already so widely known from the public that this executive order was going into place, because she had actually announced it on Friday. So it was 3 days of basic news coverage announcing that this was going to be happening. So then when we got that alert, and you got it late in the day, that it made you jump out of your seat.
It was really alarming, no pun intended there, to get that emergency alert, and then of course, as you said, a few minutes later, just happened to be that a local emergency had happened in the form of an Amber Alert that was issued. So we got another alert on top of that. It's one of those situations that I kind of compare to when someone's calling you about something. And if they call you and you miss the call and then they call back immediately, that's something you're thinking of, okay, this is a major thing. This could be an emergency. I need to take that call. And while that wasn't necessarily Governor Whitmer announces the mask wearing order is going into effect today or is in effect, and then immediately after it was the Amber Alert, it was about maybe a half hour or 45 minutes in between both of those two, if I'm recalling that time length correctly. But it's still one of those situations where you're hearing those alert tones multiple times, and and there's supposed to be one of those moments where it's a cause for concern, and you drop everything and you read what the message is, or you listen to what the message is, so that you can stay informed. And that happens twice in a row. Partly maybe the concern for these GOP leaders, as there were Amber alerts that were reported shortly after that message, and maybe it's a little bit too liberal of a use, no political pun intended on that, of the emergency alert system.
One of the things, so we have been talking at length as well about the use of masks. And we know that this is putting so many area businesses and their employees in such a sticky situation. So the mask alert on top may help fuel some of those tensions and those fears. So that could be playing into this as well. And we want to remind people, remember when you are going into a store and the employee or someone asks you to put on a mask, if you don't want to wear a mask, just remember, don't take it out on that individual, because they're not the ones mandating this. They're simply following this executive order. And yesterday we had this situation out in the Lansing area where the gentleman is accused of stabbing another customer that confronted him about not having the mask on. He was later shot and killed by police. So tensions are definitely mounting as we go forward with the mandate of wearing a mask. Just try to be kind to everyone. It's not worth your life. It's not worth the confrontation. Go on with your life. If someone says something to you one way or another, and you have to remember there are exceptions to this mask mandate. One of those being people that have health issues that maybe cannot wear a mask. So keep that in mind too. If you see someone without one, before you confront them, also know maybe they have a health reason for not having one on.
Finally, on civiccentertv.com/coronavirus, we touched on this a little bit in the first hour of the show. Oakland County has announced safety measures for the 2020 election. Oakland County officials announced several steps that they are taking to ensure 2020 elections are safe during the ongoing pandemic. Oakland County Executive David Coulter, alongside County Board of Commissioners Chairperson David T. Woodward, and Oakland County Clerk and Register of Deeds Lisa Brown, announced the steps, which include clean polling locations and absentee options, among others. Quote, "These elections are sure to draw unprecedented interest, not only because of the candidates and the issues involved, but because of the challenges of COVID-19 that are presented for conducting an election that is safe and fair," Oakland County Executive David Coulter said. Another quote, That's why this Oakland Together 2020 Democracy Initiative is so important. Our goal is to ensure safe, healthy, secure elections with full participation by Oakland County residents. So the county taking an effort to ensure that our local polling locations are going to be safe and going to be ran efficiently so that we don't have major delays with expected increases in size of lines and pace of the lines, as you have to clean surfaces and you got to maintain social distance, and that they're going to be able to do these elections, of course, efficiently with an influx of absentee ballots as well.
Is it wrong that one of the things I'm worried about is I may not get my I voted sticker? I know it's a little thing, but it's such a sense of pride for me to put on my I voted sticker. So I'm hoping that they still give them out this year.
Hopefully they will. Maybe they have them in individual instead of those you rip off of the card and you hand it to someone. So maybe that will help with it. I don't know. We'll see. We'll keep you posted on whether or not you'll be able to get an I voted sticker.
It's the little things in life, Tyler.
No,
I'm telling you.
I agree. I like it too. I think everybody enjoys getting their I voted sticker. It's one of the hallmarks of going to vote here in the United States. Ronnie and I are going to take a quick break. When we return, we'll give you some medical update. We'll get an update on the coronavirus pandemic from a medical perspective and more. You are watching and listening to the Oakland County Megacast on a family of TV and radio stations. Ronnie and I will return after this quick break.
Hello, I'm Dr. Betty Chu, Chief Quality Officer at Henry Ford Health System, and I'm with Wright Lassiter, Henry Ford Health System's CEO, to talk about coronavirus.
In uncertain times, it's natural to have questions, so I'm going to ask Dr. Chu to answer some of the common ones. First, why can't I visit my grandma to see if she's okay?
Because the elderly are at a higher risk for complications with this disease, and you could inadvertently infect her.
If I'm healthy, why can't I go out with my friends?
The larger the crowd you're exposed to, the higher the chance you could get infected and infect others.
If I have symptoms, why do I have to seek care?
While the disease isn't dangerous for most people, for others it can be. We need to understand how serious your case is, because the right choices save lives. For more information, visit henryford.com or call 313-874-1055.
Michigan, we still need to stay careful because we don't want to go backwards. Back to where we started. So keep standing 6 feet apart. Keep wearing a mask in public. And if you have symptoms, talk to a healthcare provider about getting tested. To move forward, let's all do our part. So stay careful. Michigan.gov/coronavirus.
Welcome back to the Oakland County Megacast. I'm Tyler Kieft in the studios of 89.3 Lakes FM and Civic Center TV, alongside Ronnie Dahl as well today on the program, as always, on the Oakland County Megacast. In addition, we are on a number of other community television and radio stations, including Birmingham Area Municipal Access out of Birmingham, Bingham Farms, Beverly Hills, and the Village of Franklin, and on 88.1 WBFH, The Biff, that a service of the Bloomfield Hills School District, as we continue to bring you all the local news and information about the COVID-19 pandemic and other top stories in the local area. And among the people that we're talking to on a daily basis on this program are medical experts and those out in the field that are working on the front lines as we continue to battle the coronavirus pandemic. And joining us today on the program once again is Dr. Jamie Taweel from Grand River Medical Associates. He's an internal medicine specialist and joins us today on the Oakland County Megacast. Dr. Taweel, thank you for being with us.
Thank you as always. How are you doing?
Doing all right. How have you been? How are your patients doing?
Keeping busy. Patients actually been pretty healthy. I'm not seeing too much craziness, so I'm glad to see it. People are coming in for their routine physicals rather than, emergency coronavirus stuff, which is always welcome.
Over the course of the pandemic, we've seen a lot of doctors, including yourself, take a lot of virtual exams and a lot of telehealth as opposed to having people come in person. Of course, doctors' offices have, for a while now, been permitted to take patients back in person. But are virtual exams still going on as people maybe are concerned, or maybe it's not entirely necessary for everybody to come into the office?
So I'm kind of doing a bit of a hybrid. I'm still seeing patients in the office, limited amounts, and at the same time, I'm seeing patients virtually as well. They originally approved payments for virtual visits to physicians. We were able to get paid to do those things. And the initial thought was that it was going to stop on, I believe, July 1. And then they extended it. So we're still able to do virtual visits, and not every appointment needs to be. I mean, a lot of times it's going to be just checking in to make sure you're on the right medications, checking in, or some simple stuff that can be done virtually. Telehealth visits they have their place, and they're often used, and they should be. I think this has changed the landscape where they're going to start doing a lot more of that in the future because they're starting to see the utility of it. I don't know if the payments will be the same, but and at the bare minimum, these visits can also give us an idea of whether or not it is something that needs to be seen. It doesn't substitute everything. I still need to get blood work a lot of times, but I'm able to still do that, and patients are still opting for that.
In terms of, and that's interesting to bring that up, that there may still be some utility to telehealth, and that's something that could be something that was learned during this pandemic and is put into practice in the future. What would be some of those utilities? You mentioned maybe just a preliminary exam to say, okay, yeah, you do need to come in. I probably do need to have you come in and run some tests or do a further exam. But what are maybe other uses of telehealth that would be productive without requiring people to come into the doctor's office necessarily?
I think they would be more along the lines of, in my opinion, I think they'd be more along the lines of simple things. I feel like I have a urine infection. I get this all the time, that kind of a thing. Or, a patient that says, or just needs a refill on something, or, a simple rash, something you can do a visual exam on, with a good enough story. A lot of what we do is data gathering, for specialists per se, I'm primary care. So I do primary care, of course. But if you're, for example, a gastroenterologist and you're seeing patients, you're just doing follow-ups to explain the results of the procedure that you did. I don't think that requires an in-office visit. Sometimes just discussions of results. If I get a patient and I get some bad labs, I don't need to necessarily bring them back into the office to have this conversation. Or if I want to discuss their blood sugars, things like that, that can be done telehealth-wise. I don't think that necessarily requires them to come in and put themselves at greater risk than they already do. As well as things with regards to depression or anxiety. That's more of a face-to-face visit only, rarely. I think a lot of that can be done virtually as opposed to bringing them in.
Dr. Jamie Taweel with us. He is an internal medicine specialist at Grand River Medical Associates. Dr. Taweel, on Monday this week, Governor Whitmer put, of course, a new executive order in place requiring people to wear masks in public indoor spaces and crowded outdoor spaces in order to take further precautions in hopefully preventing this current spike that we're experiencing of COVID-19 cases in the state of Michigan from continuing on, as it is a cause for concern for the state's health department and other local health departments as well. How effective do you believe that these requirements will be to helping prevent the spread of the virus in person? How effective are masks in preventing the transmission of the virus from person to person if each person's wearing a mask, if one person's wearing a mask, as opposed to if neither are wearing one?
So, without giving concrete numbers, looking at there's visual aids that people can research and see that masks do reduce that risk. If I'm wearing a mask, I'm reducing the ability to spread it to other people, as well as lessening the risk of me getting something as well. It does improve your risks. Are they zero? Absolutely not. But if we're going to congregate, if we're going to be in public spaces, the mask is going to be the best option you have, because there's not much else you can do. If you're indoors, you're breathing recycled air, a lot of times you're gonna put yourself at higher risks. Now, wearing the mask will definitely help prevent other people from getting things. It does contain a lot of your exhalations, and it will. So if two people are wearing masks, then it reduces things more significantly. Are masks foolproof? Absolutely not. And a lot of it is user error. And sometimes masks can even be a problem in regards because it allows you to touch your face more as you're constantly adjusting the mask, which is why I always recommend adjusting it with the straps rather than touching the mask itself. But, it's, again, the option that we have given the circumstances. Otherwise, it's going to be a scenario where we are completely on lockdown again. And I don't think anybody wants that.
No, I think that's definitely the case. No one really wants to have those situations. So on top of just touching the mask when you're adjusting it, it's really easy, and I do this sometimes too, where I adjust from the very front of the mask or on one of the nose grips on the mask instead of using the straps. What are some other common errors that you see in people wearing masks, and how those errors maybe are dangerous in this case in terms of passing on the spread of the virus?
I think improper usage is going to be the biggest thing. I remember saying this last time we were on this conference, is if the mask is below the nose, I mean, that's almost completely ineffective. It's not even worth it. A lot of people are wearing it around their chin like a chin strap. And, I understand that people are just trying to, not get fined given the fact that it's now a thing. And I've been getting requests already to be able to write notes for medical exemptions for masks. And that's an interesting thing in and of itself. But, for the most part, making sure that you're wearing the mask appropriately, make sure it's covering the nose, above the nose to below the chin. I had to shave my beard down because actually it was catching the mask and pulling it down frequently, requiring me to constantly readjust it. So now I got a little bit of shorter trim. Now, the other thing is to make sure that the mask is not billowing out on the sides. Try to keep it as snug as possible. That's a sizing issue. A lot of times people get smaller masks that are really pulling tight and can cause a lot of, pops off. And then the other thing I often mention is beware of those masks that have the valve on it, because those are one-way valves. So what that will do is it'll protect air coming in, but it will not protect air coming out. It is a one-way valve. So you will breathe out a plume of your own air, your own breath that can be, unfortunately, picked up by other people if you have something significant. So I always try to avoid wearing the ones that have the valve, making sure it's not wet or dirty, making sure you're not using it too much, etc.
Dr. Jamie Taweel with us from Grand River Medical Associates.
We have seen online where some companies are selling the mask exemption cards. Those obviously would be bogus, correct?
Yes, absolutely.
What are the steps? Like, if I go to the doctor, what are you looking for to be able to? Do you have an actual card that is given out to patients, such as like a handicap placard or something of that nature?
I think no. I think what people are asking for are a letter of medical exemption. So basically a letter, kind of like, the best way I can describe it is if people get migraines or issues with lights that want a letter so that they can present if they were to get fined for tinted windows on their car, or like a handicap placard thing. I personally fail to see a significant reason to require you to not wear a mask. because those things will put you at higher risk. So in my opinion, in order for me to ask you to write a letter of exemption, which by the way, I can't even be sure that will qualify as something that will exempt you from a fine or from, it may help you from a work perspective where your employer can't force you to wear a mask if you have a letter of medical exemption. But then I don't think it exempts you from getting a fine. I don't know, quite frankly. But you would have to have a condition where wearing the mask would be worse than getting COVID, in my opinion. And I fail to see a lot of examples where that would be an issue.
You're saying, in your opinion, you don't see where those situations would warrant exemptions from wearing masks, and with COVID being the greater danger than whatever the cause may be for that exemption. But that's still going to be the case. There are still going to be people that are getting their doctor's approval for exemptions from wearing the masks, or saying, oh, yeah, it's probably not as safe for this person or that person to wear masks. What elaborate on that? What are some of those potential medical issues, without giving any details, of course, of any patients or any examples, that may warrant somebody potentially getting an exemption or getting an approval to be like, yeah, mask wearing all the time may not be very safe for this person?
Certainly. Some scenarios with severe claustrophobia, severe anxiety, patients that have problems with those, putting the mask on, giving them panic attacks. I think as severe asthmatics might have an issue with it, just because they're breathing recycled heated air actually can sometimes help, but in other cases it can sometimes exacerbate those things. But there are asthmatics that wear masks because certain perfumes and certain fumes can precipitate an exacerbation. So it's kind of user dependent, so to speak. But I do believe that people that have issues with panic, anxiety, things to that effect, they're going to be the ones that are most likely trying to get a well-needed exemption for the mask.
And I would think there is a difference as well if you're trying to get the exemption because you need to wear a mask at work for 8-9 hours versus just walking into a store for 5-10 minutes.
Yeah. I've had people request, exemptions for getting on planes, things like that. And again, I can write the exemption. The letters just says that I believe this patient may not need to wear a mask. That doesn't necessarily mean that the patient can go around and not wear a mask. In other words, if I exempt you from getting on a plane, I don't know if the airline's going to, they may just not honor that and say, well, if you don't wear the mask, I can't force you to wear one. However, we don't want you on the plane. So I'm not quite sure the exemption will get you too far. I don't know for sure. I think maybe if it were a fine and you decided to contest it and you showed a letter suggesting that you didn't need to wear a mask, that might help. But this is too early to tell. There's not really a lot of examples that have been made so far.
Dr. Jamie Taweel with us. He's an internal medicine specialist at Grand River Medical Associates, with us on the Oakland County Megacast, on a family of TV and radio stations all throughout the Oakland County area. So, Dr. Taweel, good story we saw this week, earlier on this week from the Detroit News, is that there are vaccines in the works that are advancing into the later development stages, and some U.S. testing even is set very soon to begin their final testing on a vaccine. From your communications in the medical community, how far do you believe, or what's the conversation right now in terms of when we can expect to maybe see the final testing for this vaccine be done, or see a vaccine be out on the market and begin distribution?
Well, I'm getting different things. So I read an article yesterday that suggested that they're getting 100% antibody response, which is promising. Very good thing. I've been told as early as October. But again, there's a lot of legislative and administrative issues that need to be done. You never want to push out a vaccine that's not going to work. There's also not a lot of long-term data to suggest that this is going to be a good thing. So, the public needs to know that rushing something through might have unintended consequences down the line. And what I mean by that is it may not be continued immunity. You may have to get boosters, which again is a small price to pay. And hopefully that's something we can pick up before it becomes an issue. But at the same time, I'm optimistic that we should hopefully get something by the end of maybe early 2021. But again, things do take time, and these things grind, and you never want to put out something that's going to be bad. So I'm quite confident they're going to be awfully cautious. But remember, this is also a worldwide effort. So it's not just America that's doing this, it's all over the world. So hopefully things can happen sooner than later. But again, to answer your question, I've heard data as early as October for testing and public release. But then again, I'm more on the cautious side, and I think it'll probably happen after 2021, after the first of the year.
Are you recommending your patients get tested for the antibodies?
Not necessarily. Yes, for contact tracing and known exposures, things to that effect, yes. But at the same time, the antibody is not going to tell you whether or not you have an active infection. It only tells you that you've been exposed to it. And we're still starting to see some cases where people that have had previous exposures are seeing a re-exposure or a resurgence of it. So I'm not quite sure the utility of it. I will say the one thing I get asked about 30 times a day is, I was awfully sick back in February. I'm pretty sure I had it back then. Can I get an antibody test? And if the testing is available and we're able to do it, then I have no problem doing it. But I just caution that it's not going to give you that, by the way, most people did not have it back in February. Almost every time I've tested for that, they've been negative. But the other thing is that I don't want people to get a false sense of security that, okay, I see I have an exposure, I'm immune, I can go out, I don't have to wear a mask, et cetera, that can lead to further problems.
Dr. Taweel, that's an interesting point, too, because I was curious. We have so many different testing sites through Oakland County and through other organizations. Are you still doing tests as well at your facility? What maybe now, in the past, we've had results that have taken several days or have taken weeks. What is the timeline now if someone does go into your office or general other medical offices as well for a COVID-19 test with their primary care physician? How long can they generally expect? And it's different from place to place to get results.
Absolutely. It is different from place to place. It depends on the lab that they use. I use a private lab that's FDA approved and has a 24 to 48 hour turnaround time. So usually I can get patients their results within a day. There have been some FDA approved rapid tests that can give you something in as little as 15 minutes, but I'm not quite sure those are in play quite yet, or if they are, they're not as widespread. I think there might be some issues with regards to the reliability of those tests. For hospitals, it can take up to a couple of weeks. The hospitals actually, let me correct myself. Hospitals actually have a rather quick turnaround time because they're doing a lot of procedures. They need to get testing rapidly. Some offices, though, are having up to a week's worth of wait at those public testing sites where there's long lines, drive-through testings that might take a little longer. But most of the private labs in the area that have been FDA approved, pretty much a pretty quick turnaround time, at least in Michigan, for what I'm seeing.
And Dr. Taweel, when should patients of yours or just general public get tested? Because some people say, okay, I'll do it out of curiosity. Some people say, okay, I feel a little bit under the weather, or I feel really under the weather, and immediately they go to COVID in their heads. When should someone get tested? Is it necessary for everybody to get tested, or is that going to be something that could maybe overwhelm the system a little bit, and we still need to be a little bit cautious and prudent about when we're getting tested?
So that I do think the little bit of cautiousness and prudence would be definitely a good idea. So I'm doing antibody tests for patients that think they might have been exposed in the past, and I am offering that. But for patients that have an acute, symptom that feels that they need to be tested rather immediately, again, if you're going to come into my office, you're going to be stopped at the door and you're going to be screened. You're going to be asked if you had any temperatures, or you're going to get your temperature taken. You're going to be evaluated to see whether or not you had a cough, shortness of breath, sore throat, diarrhea, muscle aches, things to that effect. And if you check off enough of those boxes, you're going to automatically get a test, and you're not going to be seen in my office until that test comes back negative. You'll actually be sent back home. And if you have any symptoms that are concerning, then absolutely you should get tested. But if you're just kind of that guy that's wondering, I wonder if I've had it, or I wonder if I have it right now, I don't necessarily know that testing is going to be good. The question always remains, why order a test if it's not going to change anything you do? If you feel great and you don't get a test, and you do get a test, is it going to really change what we do? It becomes a little bit of a question. So I'm trying to reserve them for people that have acute symptoms. If they don't have acute symptoms, I will offer the antibody test to see if they've been previously exposed, to give them a little bit more of a clear idea of maybe people around them that they've, situations where they've been in where they may have been exposed previously, to better help with contact tracing and allow for isolation.
Dr. Taweel, anything else for us today, or any other information that's important for our listeners to know before we let you go?
The one thing I wanted to just make a comment on is that I'm starting to see more people being able to go to their doctors and being able to go to the hospital. We did see a jump in patients that were kind of ignoring medical problems because they were concerned that going to the hospital was the worst place you could go to. So I would encourage them to realize that it is safe. Hospitals are taking extreme amounts of precautions. Do not sit on problems that you're having if you feel, and at a minimum, try to get a hold of your physician, and even through a telemedicine visit, so they can at least discern whether or not it's something that needs to get evaluated more seriously. COVID is not the only problem that people face these days. Don't ignore all of the other medical issues that you have. Please make sure that you're doing the best you can, as we all are. So thank you for having me on, as always.
We appreciate having you with us. Thank you, Dr. Taweel, for being with us today. Dr. Jamie Taweel from Grand River Medical Associates. He's an internal medicine specialist and a regular guest of ours here on the Oakland County Megacast. And Ronnie, really interested to hear from him the specifics on when people should be seeking out a test, because it's not necessarily that there's a very sparse amount like we had earlier on in the pandemic, but it's still a situation where you want to keep the supply there for people that absolutely need the test, or people that probably should be getting one, so that we have a greater idea of, okay, this person seems a little bit like they're symptomatic, or this person and that person were around someone that had COVID or may have been exposed to it. Those are people that need to get the tests. And so knowing when's the right time to get one, or when's the right situation to seek one, is going to be something that continues to be productive for our society and the right thing, frankly, so that we don't overwhelm the system or take away resources.
You know, talking to him, I felt like I'm talking to my doctor, because all of those questions are exactly what I would ask my doctor, or I have wondered about and wanted to ask. Especially, I was sick in February. Do you think I had it? We've all pretty much said that at one point in time, so it's great to have him clear it up. And also, he made a great point. If you're coming in just to get a test, but you have no symptoms, it's not necessarily going to change anything that you do if you feel fine. So, like he was saying, unless you feel like it's for you've been exposed to someone that you know has COVID and you want to get it for that reason, otherwise, don't get the test, because if it's not going to change what you're doing day to day, then you want to keep that supply available for down the line. While we are not having the supply issue that we had in the beginning, it's probably going to be an issue as we continue on this path, if it's going to go into November, December, and January. And we are seeing the supply issue of the testing kits in other states in our country. So keep in mind, know when to get the test, speak with your doctor, and let them advise you on when it's best for you to get one of these tests. I have wondered and have even considered getting the antibody test just to see if, like you said, possibly did I have it at one point in time. Again, great advice from Dr. Taweel, as always.
And definitely continue to monitor your symptoms. If you have, like Dr. Taweel said, if you're checking off enough of those boxes, knowing the symptoms of COVID-19, you're checking off enough of them to where you're like, okay, there are several of those symptoms going on that maybe aren't as severe for me, but are there. I need to go get checked. But if you have just, a cough for a day, or you have a, dry throat because you've been talking a lot all day or something like that, I mean, maybe that's not a situation where you immediately go for a test and you monitor your symptoms. If they continue to persist or they get worse, then you seek out medical advice. And as always, we're not medical experts here in the studio, Ronnie and I. We are not doctors. Speak to your primary care physician or a physician about any advice you may need on whether or not to get tested. And then there's plenty of resources on our website at civiccentertv.com/coronavirus that can help you find a testing location if your primary care physician cannot test you on site. We're going to take a quick break, and when we return, we'll talk about Parks and Recreation Month and many different activities that you can participate in the greater West Bloomfield area, in the Bloomfield area, and all throughout Oakland County. You are watching and listening to the Oakland County Megacast on a family of TV and radio stations.
Hello, I'm Dr. Faust, Medical Director for the Oakland County Health Division. Coronavirus disease 2019, or COVID-19, is a new disease caused by a new respiratory virus named SARS-CoV-2. COVID-19 was first identified in December 2019. There is currently no vaccine to prevent coronavirus disease 2019. The best way to prevent illness is to avoid being exposed to this virus. Wash your hands often with soap and water for at least 20 seconds, especially after going to the bathroom, before eating, and after blowing your nose, coughing, or sneezing. Clean and disinfect frequently touched objects and surfaces using a regular household cleaning spray or wipe. Avoid close contact with people who are sick, and avoid touching your eyes, your nose, your mouth. Cover your cough or sneeze with a tissue, then throw the tissue in the trash. Finally, stay home when you're sick. For more information about coronavirus disease 2019, go to oakgov.com/health or call 1-800-848-5533.
Welcome back to the Oakland County Megacast. I'm Tyler Kieft in the studios of Civic Center TV and 89.3 Lakes FM alongside Ronnie Dahl. We're also on Birmingham Area Municipal Access, both of our TV stations on Comcast Channel 15 and AT&T Channel 99. And we're also on the radio, 89.3 Lakes FM, live streaming online on lakesfm.com. And we're on 88.1 WBFH, the Biff, and today, our Facebook partner is West Bloomfield Parks as we continue to celebrate Parks and Recreation Month and to tell us about some of the great activities going on in West Bloomfield, through West Bloomfield Parks in the summer months and going into the fall as well, and some new programs in place, as well as how people can engage with local nature and recreation departments such as West Bloomfield Parks. We are joined now by West Bloomfield Parks' Recreation Superintendent, Kelly Heyer, with us on the Oakland County Megacast. Kelly, welcome to the program.
Hello, good morning.
Good to see you. Good to talk to you. How are you doing? How's the team at West Bloomfield Parks?
Oh, we're doing awesome.
Yeah, it's definitely an interesting time for all of you there. Definitely a time of change as the summer months are really active for parks and recreation departments all throughout the state of Michigan. It's a great time of the year for traveling and for sightseeing and for experiences out in nature. I know that West Bloomfield Parks does a lot of communications with other parks departments in the local area and definitely in the state area through M Parks. What's kind of the conversation been in terms of setting goals and forming new ideas for this coming summer to still engage your local communities and encourage people to go out into nature and go out and recreate at their local parks despite the pandemic that's ongoing?
Well, absolutely. That's good insight there, because right away back in March, we were the only solution for people, right? So we had to come together, and every municipality actually had leadership directives from either their elected officials or their directors, and went in a little bit of a different approach. But we were very fortunate to be supported here in West Bloomfield, where we were able to keep our parks open. And we did have to close a lot of amenities at first, but now we are open except for drinking fountains. And yeah, this is what we're known for in Michigan, is the great outdoors. So we're very fortunate for the programming aspect. We had to reinvent ourselves. So we had to put the brakes on back in March and April and rethink a lot of things through how we were going to approach in-person events. And we also never had done virtual recreation before. So we had to think about, okay, how do we approach this? What's our platform, opportunities, options? And not everyone's comfortable on Zoom, teaching on Zoom, instructing, presenting on Zoom. So we had to think about that. We actually had to recreate probably 90% of our content. And we have such an amazing team here, and I can't thank them enough for all of their hard work and dedication, because as you have said, we have been working statewide with other recreation professionals. And I think we are leading the industry right now with all of our creative programs and our options right now for our residents. And if you compare us to our neighbors in Oakland County, everybody else has been right there with us, and Oakland County Parks, our metro parks. So if you do live here in West Bloomfield or Oakland County area, you were very fortunate because we were able to keep a lot of things active outdoors.
Kelly Heyer with us. She's the Recreation Superintendent at West Bloomfield Parks. And during this time, it's been tough for everybody, but it's been particularly tough, especially in the recreational and the social aspects for seniors in our communities, especially as they're more susceptible to the COVID-19, and a lot of their programs that are in person have been canceled, and virtual programs are maybe tougher for them to engage in or learn to be engaged in, especially during this time where there's less training available. In West Bloomfield or in other parks and recreation departments that maybe your department may be partnering with, what are some programs that are available now for our local seniors to keep them engaged in the community, especially with facilities like Connect in West Bloomfield being closed after being so impactful after its opening?
Oh my goodness. Okay, so the senior spectrum is all over because some seniors, they're very active and healthy, and they feel very comfortable with going out. And then you have the other end of the spectrum where they maybe had some underlying health concerns prior to this, and maybe their accessibility is limited. And so we've tried to approach this and come up with a variety of things. So we do have the virtual platform, but the challenge there is not everybody has access to internet, a computer, laptop, smartphone, a desktop. I've run into a lot of seniors who are on the phone, mostly talking to them, is they would use their public library to check their email accounts. And as you all know, the public libraries were one of the first things to close as well. So we have had to make sure that our seniors are getting the information, other avenues, and we can't just rely on email. So we do have a senior newsletter. If our senior residents are signed up to receive that, they can call us right now and get signed up for our next edition. But we do have virtual programs, and we have investment series, learning about real estate, to we have a COVID resource workshop coming up later in a few more weeks. To fun things, we have a travel program coming up also the first week of August. So yes, the social aspect is really challenging to continue that. The in-person opportunities, again, it's everyone's comfort level is going to be different. So for more active adults that want to come out, we are having the concert series start this Wednesday. Unfortunately, we're sold out for tonight, but next week is available. We have our Segway series starting next week, and so you can ride a Segway down the trail. We have a Tai Chi going on in the parks, but with that, our instructor is also teaching virtually, so there's some choices there. We have also our senior picnic in the park. We've adapted that a little bit to account for COVID. And so we'll see that's later on in August. But we love to hear ideas too. There are definitely limitations, and we recognize that. But if we don't hear your good ideas, then we can't plan for them. So if there is anybody out there that you're looking for something specific, or maybe you've seen a neighboring community offer it, we'd love to hear from you, because right now we feel like that we are an essential service in people's everyday lives. And whether you need us virtually on the phone or you are coming to one of our park facilities, we're here for you right now.
Kelly Heyer with us on the Oakland County Megacast. She is the Recreation Superintendent for West Bloomfield Parks. On top of senior programs, the summer is huge for family programs, as more families are taking time off from work usually to engage in different activities with their kids and with their families as an entire group. And as kids are going to summer camp. So we talked earlier on in the week about the summer camp programs with Megan Kernat from your organization. But in terms of other programs that are still out there for families, both virtual and in person, what are those that are in place now? What are some that maybe have been modified that families are used to? And what are some ways that these families can get involved in the parks and recreation available to them in their community during this time?
Yeah, so part of it is when we were evaluating our programs, we wanted to maintain as much as we can. So our nature education and interpretation programs have been a very popular thing always with West Bloomfield Park. So our naturalists are really talented individuals. And so we were able to rethink our nature open hours. So that is a couple times a month. You can look on our website for that schedule. You do now have to pre-register for open hours. We have our Mommy and Me hikes. We have a fun family insect safari plans for next week. That is also pre-registration. We have Speak with the Space Scientists coming up. That's a virtual program. We're partnering with NASA scientists. And if you take a look at our program, guide that's going to be released on Tuesday, that has all of our lineup for August and September. You're going to see some fan favorites returning. Obviously, we've made the COVID adaptations, and then we've rethought things and brought some new things to the West Bloomfield residents. So that will be released on Tuesday, Tyler.
Often recreation includes social activities, and with the governor's new executive order requiring masks in public indoor spaces and in crowded outdoor spaces, that maybe social distancing measures can't be put in place. What measures are being put in place by West Bloomfield Parks to ensure that people that are coming to these events, A, are healthy, but then B, when they're at the events, on top of that, are able to maintain these rules, especially in places where, like concerts and so on, where there's less social distancing maybe available, so that people that maybe don't have masks or forget them at home or whatever the case may be can still attend and can still participate?
Mm-hmm. So first off, we started training our staff. So all of our staff goes through a specific PPE training, as well as best practices in dealing with the public and making sure they feel comfortable, we feel comfortable, and then also pre-communication. So at West Bloomfield Parks, if you've signed up for a program, we've always done a good email confirmation or answer questions over the phone to our customers. So we've had to modify that and include the mask expectation, reminders about if you have a question for staff, stay 6 feet away, we'll answer them from 6 feet away. But yes, I'm glad you brought that up, because we are in West Bloomfield fashion. We're able to get some reusable masks done up right away. So we have masks and buffs if you were to forget. Limited availability, but we have some disposables too. The other thing we're doing, depending on what program you're signed up for, or right now coming into our office, we do health screening checks. So staff have been trained, and we go through the standard questions that Oakland County has issued to all local businesses. And we do have to temperature check you as well. So that's a precautionary measure. And that's happening at our camp program. So we've taken the concept of the parent drop off and pickup lines at schools and adapted that, our version, for camp drop off. So the parents don't even need to get out of the cars. The kids are temperature checked and screens right from their cars, and then they pull up and are able to get dropped off with their camp counselors. So those are just a few examples that we've done. And then the last thing I would say is our signage. And if you've been on the trail or in our parks, we always have had good signage, but we added additional friendly reminders and try to change up the location of those signs and the visibility of those signs so people aren't complacent. And especially now with the new executive order, the reminders of masks is even more important, as everyone's been talking about this week.
So I know that you mentioned about the Marshbank music event happening tonight. Even though tickets aren't available, is there a way for people who didn't get a ticket or maybe aren't comfortable with actually going out into a large crowd right now for them to enjoy this as well?
Yeah, and that's one of the reasons why we still made the decision to maintain the concert series. We wanted to bring an element of something different and for people to look forward to. And so, of course, you guys have been great partners with us, and specifically for Marshbank Music Series, this is our third year in a row partnering now with Motown Digital and Lakes FM. So we're going to be broadcast live once again on the radio on 89.3. So if you guys, we've already talked about that, but you will be on site and broadcasting live. And then we're going Facebook Live. Motown Digital, again, our gracious partner, is helping us, going to bring you some great sound feed there. So depending if you're a radio listener or a Facebook person, those are two options for you.
Well, Kelly, anything else that we can expect going into the future, even beyond the summer, maybe in terms of programs that are in development, maybe for late summer or in the fall, or any other information that we should know from the West Bloomfield Parks as we continue to celebrate Parks and Recreation Month?
Oh, you know it. Well, again, I can't speak highly enough about the talented team we have here of recreation professionals. We are working hard already on your fall and winter events, because what everyone's talking about in Michigan, what are we going to do come November if we're still in a phase 3 or phase 4, or go back to phase 3? what is going to be our options for Parks and Recreation. So we will have another edition of our fall guide coming out in August. And then we'll put another one out probably 2 months from there. And we're ready. All of our bigger events, we've come up with a couple different options depending on which way we need to go. And we are going to lean heavily more on a virtual platform because we feel it's easier to take the virtual and then make it live in person if we are going in the right direction for the state of Michigan. But curbside is going to be, and drive-through is going to be more of our way of doing things. Santa, we've had conversations with him. What is he going to do come December with all the kiddos out there? So we're on top of our game because we want to make sure that happens. And then we're trying to make a deal with Mother Nature because we really need to come through with a snowy, nice winter if we're going to get out there on our snowshoes and cross-country skis and do some winter hikes. So if you're out there, Mother Nature listening, please, Michigan could use a nice, fun winter.
Well, Kelly, we appreciate having you on. If people want to find more information, just about another minute with you, where can people get more information on these programs?
WBparks.org is our website, and we keep that updated almost daily. The second thing is you want to sign up for our weekly email blast, the Recreation Rundown. And that email blast, we keep the content light, but the priority things that you need to know, we put right in there. And then, of course, all of our social media channels. We are very active on Facebook and Instagram, very fun there. And then, of course, you guys help us out all the time by inviting us to be your guests.
Well, Kelly, we appreciate having you on. Thank you very much for being with us today.
Yeah, and so hope to see you guys tonight.
Yep, we will. We will be out there tonight. Kelly, thank you for being with us. Kelly Heyer, the Recreation Superintendent for West Bloomfield Parks, with us on the Oakland County Megacast, as we, of course, will be broadcasting each and every one of the concerts from the Marshbank Music Series every Wednesday. You can find more information on that on WBparks.org. And, of course, listen to it live right here on 89.3 Lakes FM. Really interesting to hear from Kelly, and earlier on in the week, even to a certain extent from Megan, on the programs that are being modified and are being placed in different areas and turned around a little bit for groups of people that maybe are at a little more of a risk, like young children with their camps not being in place, and definitely seniors who aren't able to recreate as much because of the scare of COVID-19 being something they're so susceptible to.
We are so lucky to have the West Bloomfield Parks in our backyard. And so in these COVID times, instead of thinking about what we've lost, think about what we've gained and have gratitude for what we have. And it is such a pleasure and such a blessing to have the parks available to us. It's right here. It's easy to access, and most of the events are free. So thank you to all of the hardworking staff over at the parks for doing everything that they've been doing.
Yeah, West Bloomfield Parks has always been so gracious with us and also with just the community at keeping people informed on what they're doing and keeping new and fresh programs in place. And I can say that about all of our local parks departments as well. We talked to many others over the course of the pandemic, and they're doing amazing things as well. So whether you're in West Bloomfield or you're in an immediately neighboring area, or you're in another place in the community like Auburn Hills or so on, there's plenty of parks and recreation opportunities for you. It is Parks and Recreation Month, and what better way than to celebrate that month and to celebrate the times and to celebrate Parks and Recreation Month and celebrate the great nature we have in the state of Michigan than to go out to your parks and hang out for a little bit and spend a day out there exploring nature or playing a little bit of games or enjoying time with the family. So that is something that will continue to be done throughout the month of July as we celebrate Parks and Recreation Month, and hopefully well beyond. And we encourage you to check out your local parks and recreation departments information for programs going on in your community. That is going to do it for our show. Just about a minute left in today's program. We want to thank everybody involved each and every day, you the listener, for tuning in to us on our family of TV and radio stations all throughout the Oakland County area. Special thanks, of course, to West Bloomfield Parks today for being our Facebook partners. We've been broadcasting live on their Facebook channel via Facebook Live In addition, thank you to our guests, Captain Dan Edwards from the Bloomfield Township Police Department, Suzanne Levine, the Executive Director of the Greater West Bloomfield Chamber of Commerce, Dr. Jamie Taweel, Internal Medicine Specialist at Grand River Medical Associates, and Kelly Heyer, of course, our final guest today, the Recreation Superintendent from West Bloomfield Parks, with us on the Oakland County Megacast. In addition, thank you to our crew, Ryan out in the studio, our technical engineer today, keeping us on the air, making sure everything sounds good and looks good out at Master Control, and out to you, the viewer and the listener. Of course, to our booking producer, Jake Kustash, our Zoom producer, Larry Nyland, as well, each and every day. For Ronnie Dahl in the studio, I'm Tyler Keefe, thanking you for tuning in today's edition of the Oakland County Megacast.